So we've all had our blood pressure taken at least once in our lives, and some of us don't know why the doctors do it or how they know our blood pressure. So today I'm going to show you guys how to take blood pressure, and I've known how to do this for over a year now. Blood pressure is linked to health problems a lot of the time, and so for example, if you have low blood pressure, you might feel like you're going to faint or you might pass out, like my dad. So it's important that you guys make sure your blood pressure isn't too high or too low. So first, what you're going to do is you're going to ask the patient, or make sure that they don't have any medical problems, make sure that they haven't smoked in the last 30 minutes, and that, or ask them if they're taking medication, because medication can affect the patient's blood pressure. So assuming that Amanda hasn't smoked in the last 30 minutes, go ahead and put your arm out. So this is the cuff, and if you guys, I'm sure you guys can all guess this, I'm going to put this around her arm, and you want to make sure that it's not too tight, but also not loose enough to where it's falling off her arm. So what I usually do is I put my fingertips inside when I put it around her arm. That way I know that it's not too tight, not too loose. Okay. So then what they do is they take a stethoscope, and this side you're going to put it on their artery so you can hear their pulse. And then I'm going to pump the cuff up. And then they'll pump the cuff up to about 150, and the normal blood pressure is 120 over 80. And make sure you don't pump it past like 160, because one time I did it on myself and I pumped it up to like 180 and I couldn't feel my arm for like 10 minutes. So I'm going to pretend, actually I'm not going to do it, but I'm going to pretend to pump it up to 180, or 150, sorry. And then as I release the valve, you turn the valve open, or you open the valve. And what this does is it lets air out. You can kind of hear it. And then the needle, when the air comes out, it's deflating the cuff. So the needle is slowly coming down. So the needle starts at 150, and when I open the valve, that's when the needle's going to go down, and you're going to listen for the first pulse in her arm. So let's say her blood pressure is 120 over 80, and I hear the first pulse at 120. So that's what I'm going to mark down, and then I keep hearing her pulse until the needle hits 80, and then I can't hear anymore. So her blood pressure would be 120 over 80. So from the first heartbeat you hear to the last, or pulse, from the first pulse you hear to the last pulse you hear, those two numbers is how you get your blood pressure. So if you're going into the medical field, you're most likely going to need to know how to take blood pressure, and it's pretty simple. So you put the cuff over their arm, you put the stethoscope on their artery, you pump the cuff up to 150, and then as you release, or as you open up the valve, you listen for the first pulse to the last pulse, and that's how you get blood pressure. So now you guys know how to take blood pressure.